Hi, I'm Kelly.
Hi, I'm Caitlin.
Hi, I'm Kayla.
Hi, I'm Gianna.
And I'm Kiana, and we're the dental assisting students of Cape May Tech. Today we're going to be discussing the tips and tricks on how to keep up with your residents' oral health and why maintaining their oral health is so important. If you don't brush your residents' teeth, it can prevent them from eating and drinking, and they can even get open sores and lesions in the mouth. An active tooth infection can go into the bloodstream and possibly cause a heart attack. And if your residents have poor oral hygiene, they may suffer from gum disease, which can affect their overall body health. So now I'm going to hand it off to Kelly, who's going to be going over the instructions on how to properly brush the residents' teeth.
Okay, so I'm going to go over a daily routine that all of your residents should follow. The products I'm going to use today are a soft bristle toothbrush, floss, and a mouthwash. It's really important that all of these products are ADA approved because they've been proven to be the most effective. So the first step is brushing your teeth. So I'm going to use a recommended manual toothbrushing technique known as the Bass method. When using this method, you want to angle the toothbrush at about 45 degrees with a focus on the gums. Okay. To get the 45-degree angle, you want to cut the toothbrush down the center and angle half of it towards the gums, like so, and move back and forth. And you want to make sure that you have the front of the teeth, the back of the teeth, and the chewing surface. Next, the floss, about an arm's length of floss. You're going to wrap it more around one finger, once or twice around the other. Slide the floss in between each tooth, hugging both sides and underneath the gums. And as you go, unravel the one side and ravel the other so you're not using the same piece of floss. And lastly, your mouthwash. Get about a cap size full, swish for 30 seconds, and spit it out. And just doing all of these daily will help to maintain and improve your residents' overall oral health.
The next option that I'm going to be going over are the Interdental Brushes. These are going to be useful for your residents that might have the wider gaps in between each of their teeth, because that's going to let bacteria and food sit in there more easily, and regular floss may not help. So to use your interdental brush, you're going to place it in between each wide space. You're going to insert the tip, and then you're going to gently slide it back and forth a couple of times. You're going to do this on the cheek surface, and then you're going to switch and go on the tongue surface as well. So you're getting both sides. Again, you're going to want to have your cup of Listerine nearby so you can dip the tip in and get the debris off when they come out. To use your air flosser, you are going to place the tip on each space in between the teeth, and you're going to use the puffs of air, and then you're going to switch again and go to the tongue surface and do the same thing. To use your small bristle brush, you're going to go on their chewing surface where they have the dips, and you're just going to get in there and make sure that you're getting the bacteria out that's sitting in there from the day. And again, if you need to, you can dip this in the cup of Listerine as well to wash the debris off. For their bridges, you can use the air flosser, or you can use the proxy brush as well. Whichever one fits better, or whichever one you have, just make sure that you're getting that food and bacteria from the day out as well.
I'm going to be talking about the triple bristle toothbrush. We recommend this toothbrush because it can brush all surfaces of the tooth at one time. To use this toothbrush, you would just place it on each tooth for 2 to 3 seconds, slowly making your way around the mouth. This would make a good gift for your residents, friends, and family for holidays and birthdays, and it could be placed on the moving in list for your residents to have when they move in. To use this toothbrush, we recommend starting at one corner of the mouth and placing it on each tooth for 2 to 3 seconds, slowly making your way around. This toothbrush is $70, and it comes with 2 interchangeable heads, a handle, and a charger. If you can't afford to invest in this electric triple bristle toothbrush, you can purchase a manual one for much cheaper.
I'll be going over how to care for your residents' removable appliances. I'll discuss how to keep the appliances in good shape and how to reduce bacteria from getting into the mouth. We don't recommend using toothpaste because it can create small scratches on the appliances. To clean the appliance, we recommend using the pointed side of the bristle to clean the part of the denture that touches the palate. We recommend using the flat side to clean the teeth. And then you would place the denture inside the closed container with the teeth facing down.
Another tip we recommend is getting a whiteboard for your residents, like this one, and writing down their oral care schedule. For example, how many times a day they've brushed, and if they've cleaned their partials or dentures. Most importantly, take note of anything abnormal in the mouth and refer your resident to a doctor because it could be signs of oral cancer. We hope you can take these everyday tips and tricks and implement them into your workplace.